Hello, my name is Clayton, and I'm here today to present a lit review about electronic medical records. The objective of this lecture is to present an overview of security and privacy levels in EHR and some pros and cons about their adoptions. However, the most important is to show how central this medical tool is to the modern health care system and why it's to become the backbone of the digital health in the United States. Shall I begin? The learning objective of these presentations, the history. We're going to go over some difference between MRHR. We're going to talk about some attributes. We're going to see the acceptance of the public. We're going to talk about some barriers in the adoption of HR. And we're going to discuss about the security and some standards in healthcare system. Moving along. What's the purpose of a patient medical record? After looking at so many definitions of medical record, I came across with the Dr. Razor Code, and my opinion was the best one. Define word for word what medical records are. According with the doctor, is a recall observation to inform, instruct students, gain knowledge, to monitor performance and justify interventions. Look a little into the history of medical records. Medical records trace way back in 200 BC in China, where the Chinese physicians used to keep notice about their patients. However, in the United States, approximately in 1892, to the facts when the immigrants started coming to America, and they used their documents to create medical records to gather notes to ensure they were free from any disease. The transitioning from paper to electronic record, historically, patient records have been paper-based over the years. However, there was a need to move from paper records since it was significantly limited and hard to share those records with the other physicians. Actually, it was a persistent pursuit of the decentralized way to keep these records and use this information from these records to improve caring conditions. With the advance of technology, the pursuit focused towards the computerized medical records with the ability of interoperability. So this slide we can see in 2004, the electronic record debuted, but in 2009, with the American Recovery and Reimbursement ARA, the implementation of EHR started to increase. Well, some data tells us it's still pretty slow, besides nearly $30 billion in federal investments until 2017. Next slide, we're going to talk about the difference between EMR and EHR. Both contain the private information, but the difference is just the interoperability of the data. One is intra-organizational and the other one is inter-organization. Next, we're going to talk about this HIE. As I mentioned before, the most significant characteristic of electronic health records is interoperability, the communication between healthcare providers. This translation is possible because of mutual agreement between health system providers and payer. Working a real central translator for all data between different applications, storing a list of terms, concepts, and standards. With a big impact on healthcare system, where they reduced the repeat imaging laboratory testing 25%, is very important for track population health and public health, and studies show a big contribution in clinical research and trial, and productivity gains. Moving ahead, we're going to talk to a bit about the objective number 3, the attributes of medical records. First, the study shows the EHR reduced duplication of tests, duplication of prescription, and redundant administration paperwork. And with the HR adoption, we will decrease malpractice, saving physicians and a hospital a lot of money. Finally, the most important point is the reduction of medical errors. Credit to another EHR feature, the CPOE. Next, we're talking about the accessibility of point of care. In this attribute point, we must emphasize records available 24 hours. Moving ahead, security and privacy. Well, due to the fact that now we have a data being exchanged between healthcare professionals, security become a giant elephant in the room, in consequence to increase threats, breaches, and cybercrime. So as I mentioned before, the HITECH Act in 2009, sponsored by ONC, and with the HIPAA compliance, a new secure certification was introduced, including requirements for database storage, encryption, and encryption with transmission of this data. Last but not least, the remarkable effect of patient outcome, improve the quality of continued, in patient care, like as reminders and clinical alerts. And with the expansion of the Internet of Things, this quality of continued care will be great for the patients. We have reminders to physicians too, such as drug-to-drug interaction, consequently lowering the medical error factors. Finally, the crucial benefit of EHR, since modern medicines face so many challenges nowadays, the seamless exchange of information among healthcare providers. Because good communication, translation, and the correct way of exchange this information are crucial for patients' life. Next objective is number 4, and the acceptance of the public. The general public is favorable with electronic health records. And we can see 55 believe we reduce the medical records, 60 the reduction in healthcare costs, and 54 agree it will influence their decision on selecting a personal physician. Objective number 5, potential barriers to adoption. According to the authors of this lead review, the main barriers to adoption in HR is the cost. Even though if there's the reimbursement act by the federal government, it's still a significant rejection among physicians and healthcare providers due to the cost of the implementations. The headaches with the new softwares, who usually have a tendency to slow down the process and the physician's work. My point of view is that technology is not perfect. And sometimes more technical advanced the system becomes, more and more bugs and delays in the system of operation will occur. Next bullet point is lack of interoperability among some products. We still have some old legacies of medical software without any improvement to collaborate with the adoption. Lastly is the secure gaps. Like my cybersecure friends always state, everything can be hackable. It's just a matter of time. So guys, be prepared and do your job and be proactive. Next objective number 6, secure standards in healthcare system. We're talking about HIPAA, since it's the first organ who regulates the EHR in the United States. We need to highlight the 3 pillars to secure health data. Is administration, physical, and technical safeguards. The administration policy and procedures risk analysis management, the physical safeguard, and the technical safeguards, and the firewalls and encryptions. The next standards is the SIA triad. The three-tier model is a widely used in information security, frankly, in the healthcare system. This model helps to organize secure procedures and policy. The SIA objectives are necessary to protect sensitive healthcare information. First, we have a confidentiality, integrity, and availability. Moving ahead, we have a security standard and law. Several other regulations or industry standards deal with the privacy and security protection, such as ISO 20000, NIST SP 800, and PCI DSS. One deals of more European, international IT, the ISO 20000. The NIST 800s work with more frameworks, and the PCI DSS is that regulates the credit card payments. The price of healthcare data death. Since 2010, 100 million individuals' records have been stolen, and the average price paid on the black markets goes to $20 to $50. On the other hand, ONC HIPAA will penalize the healthcare providers for leaking of patient medical records. For example, Athens in Indiana was fined with 115 million, with 80 million patients' records were stolen. And finally, our conclusion. In summary of this overview, we highlight some steps to mitigate the security and privacy of electronic medical records, include patient and healthcare organizations such as healthcare workers and patient education, password security, data encryption, and installation of firewalls. Second, use the three pillars from HIPAA. The Climate Research Survey concludes that 45% of secure personnel working with HR chose technical safeguard as essential tools to mitigate secure and privacy of EHR. And the last, most authors of this little review concludes the financial cost, as I mentioned before, is the number one factor in slow the implementation of electronic records. Those are my reference. Well, guys, since modern medicine faces many challenges, we need to accelerate the adoption of electronic medical records. Thanks for the patience. I will see you soon.